coronavirus disease, or COVID-19, is an infectious disease caused by SARS-CoV-2 virus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. The virus can spread from infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from large respiratory droplets to smaller aerosols. You can be infected by breathing in the virus if you are near someone who has COVID-19, or by touching a contaminated surface and then your eyes, nose, mouth. The virus spread more easily indoors and in crowded settings.
In 2 years and counting, Filipinos experience the worst that they can feel in their life, losing family, friends, or even your lover. Everyone can suffer from this. There are already over 2.74 million positive cases in our country. It can be possibly increased in no time. Also, let us not forget the 41,237 death cases, and the 8.5% of that are the children under the age of 18 years. Thousands of Filipinos are getting confirmed positive in COVID, and hundreds of them are dying in a day because of lack of facilities to confine and accommodate every patient. And up until now, there are still children who are lying on the hospital beds fighting for their life, wishing to get better day by day.
Results of COVID-19 vaccines are effective. They can keep you from getting and spreading virus that causes COVID-19. Vaccine also help keep you from getting seriously even if you do get, and you can also resume many activities that you did before the pandemic. Getting vaccinated yourself may also protect people around you, particularly people at increased risk for severe illness for COVID-19. Vaccines continue to be highly effective at preventing hospitalization and death, including against this variant. Fully vaccinated people with breakthrough infections from this variant appear to be infectious for a shorter period.
There are many reasons to get vaccinated, and it's important to know that all vaccines in the Philippines are free. COVID-19 vaccines that are granted with emergency use authorization, also known as EUA, by the Food and Drug Administration, are considered safe, effective, and play a crucial role in ending the pandemic based on the available evidence to date. Wearing masks and social distancing help reduce your chance of being exposed to the virus or spreading each other. But these measures are not enough. Vaccines will work with your immune system, so it will be ready to fight the virus if you were exposed. And another huge benefit of getting vaccinated, you can finally start doing some of the things you loved during pre-pandemic, some of which includes gathering inside a home or private setting.
Effects of having a vaccine. COVID-19 vaccines are effective. They can keep you from getting and spreading the virus that causes COVID-19. COVID-19 vaccine also help keep you from getting seriously ill, even if you do get COVID-19. Getting vaccinated yourself may also protect people around you, particularly people at increased risk for severe illness from COVID-19. COVID-19 vaccination will help protect you from getting COVID-19. You may have some side effects, which are normal signs that your body is building protection. These side effects may affect your ability to do daily activities, but they should go away in a few days. Some people have no side effects. Serious side effects that could cause a long-term health problem are extremely unlikely following any vaccination, including COVID-19 vaccination. Vaccine monitoring has historically shown that side effects generally happen within 6 weeks of receiving a vaccine dose. Getting vaccinated provides greater protection to others since the vaccine helps reduce the spread of COVID-19.
Possible side effect. Your child may have some side effects which are normal sign that their body is building protection. On the arm where you got shot, expect after vaccination, pain, redness, swelling throughout the rest of your body, tiredness, headache, muscle pain, chills, and fever. This side effect may affect your child's ability to do daily activities, but they should go away in a few days. Some people have no side effect. Ask your children's healthcare provider for advice on using a non-aspirin pain reliever and other steps you can take at the home comfort your child. It is not recommended you give pain reliever before vaccination for the purpose of trying prevent side effects.
Mask. Save lives. Clean your hands. Keep a safe distance. Get a vaccine when it's available to you. Protect yourself and others around you by knowing the facts and taking appropriate precautions. Follow advice provided by your local health authority. To prevent the spread of COVID-19, maintain a safe distance from others at least 1 meter even if they don't appear to be sick. Wear a mask in public, especially indoors or when physical distancing is not possible. Choose open, well-ventilated spaces over closed ones. Open a window if indoors. Clean your hands often. Use soap and water or an alcohol-based hand rub. Get vaccinated when it's your turn. Follow local guidance about vaccination. Cover your nose and mouth with your vent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention. Call in advance so your healthcare provider can direct you to the right health facility. This protects you and prevents the spread of viruses and other infections.
Insight about having vaccination to those 12 years old above. The risk for being hospitalized for COVID-19 after the vaccination is 0.5% for the adult, while getting the risk of having a COVID is those who are not vaccinated, which is 18 years old below. On my opinion, getting vaccine for ages 12 to 17 years old is a right decision, and by getting vaccinated, young people can help more businesses fully reopen safely by increasing safety and driving down infections. That would also help young employees who have been hit hard economically.
Vaccination for minors aged 12 to 17 is started, and I agree with that. Why? Because COVID-19 is not a joke. It is a virus that can cause death. Minors deserve to have a protection from COVID-19 by being vaccinated. The COVID-19 vaccines are safe and effective. Getting one can protect kids from getting infected with the coronavirus that can cause COVID-19.
Vaccination is not a joke because an individual's health depends on it. But it's important to protect a person's health against the virus. So it is needed to be vaccinated, especially young people who need more protection against the virus.
I agree with the implementation of vaccination for children because we all want freedom after this pandemic. You can also infected with the virus indiscriminately, but the vaccine should only be the one the children's bodies can handle.
CDC recommends everyone 12 years and older should get a COVID-19 vaccine to help protect against COVID-19. Widespread vaccination is a critical tool to help to stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. Getting a COVID-19 vaccination can help protect your child from getting a COVID-19. Early information shows that the vaccine may help keep people from spreading COVID-19 to others. They can also help keep your child from getting seriously sick even if they do get COVID-19. Help protect your whole family by getting yourself and your children 12 years and older vaccinated against COVID-19. I agree with this implementation because all of us can be infected by COVID, and COVID does not choose who's gonna be infected, and all of us deserve a face-to-face in every aspect of our lives, especially in our schools. We deserve to meet our teachers classmates so that we can learn effectively. We deserve to meet our relatives which is far from us. We deserve to meet a friend which have not seen for a long time. And to be productive also. That's why I agreed in this implementation so that no one's gonna left behind and nothing will be unfair.